Hello, you're welcome to Skyline Tutorials. For today, we'll be beginning a series in human anatomy. We'll dive into the fundamentals and the foundations of the human body, the functioning, the structures, and what the human body entails. It is very imperative, whether you're a science student, an art student, or just a curious learner, to know about the structures and composition of your body. So the objective of this class is to, one, be able to define anatomy and derivation. The second is to note the subdivisions of anatomy. And then you should also know differences and relationship between anatomy and physiology. Okay, so for this episode in anatomy series, we'll be focusing on the definition of anatomy and what it is derived from, the subdivisions or the different fields in anatomy. And then we are going to look at the difference and relationship between anatomy and physiology, being that they are closely related courses. Okay, so we begin with the definition of anatomy and as well the etymology of anatomy. Okay, the word anatomy is derived from two ancient Greek words, ana and tom. Ana here simply means to cut, and tom means apart or through. So if I join these two words together, it will give rise to cut through or cut apart. In the ancient days, when you want to study the structure of the human body, they make use of dissection. They carry out dissections in different parts. They cut through or they cut apart the different body parts to study the human body. But in recent times, they have come up with different modalities to aid in the study of the body system. That will lead us to what the definition of anatomy is. Definition of anatomy. Anatomy basically deals with the organization, shape, and structure of the human body in relation to one another. Anatomy is defined as the study of the organization, shape, and structure of the human body. We can abbreviate that as BOSS, the body's organization, shape, and structure. Okay, so we have here organization. Organization simply means the makeup, the composition of the human body. The shape, what is the shape of all of these parts of the human body, and then the structure, what is the form or the nature of the different parts of the human body. So that's it for the definition and derivation of anatomy. I come again, it is derived from two words, ana and tom, cut through or cut apart in English. And then we defined anatomy as the study of the body's organization, shape, and structure. The next we'll delve into for this episode is the subdivisions of anatomy. So let's look at that keenly. Okay, anatomy generally has two broad fields. So I have anatomy and its field. The first field of anatomy we have is the microscopic anatomy. And then we have the macroscopic anatomy. Okay, so let's look at each individually and see what they entail. Microscopic anatomy. The word micro simply means minute or small. So if we want to use that to define this, we can say that microscopic anatomy is the study of structures Remember, anatomy deals with the structures of the human body. So microscopic studies structures that are not visible to the unaided eyes. We can also define it as the study of structures that cannot be observed with an unaided eyes. So there are different terminologies we can see from that definition. We can see an unaided eye there. So let's know what an unaided eye is. An unaided eye is simply the use of just the naked eye. We don't use any equipment or tool to visualize any view in the system. So if there is no use of an equipment to visualize or to zoom up any structure, we say that the eyes are unaided. You can also say it is a naked eye. The next um, concept we should look at for the study of microscopic anatomy is that it uses a microscope. A microscope. So, for us to be able to visualize these structures that cannot be seen with an unaided eye, we have to aid our eyes. And the tool we used in doing that is the microscope. So for you to study microscopically the structures that are not visible to the eye, we make use of a microscope. Please take note of that. The next we'll look at is the subdivisions of microscopic anatomy. Microscopic anatomy broadly can be categorized into two. So we have here the cytology and we have the histology. So microscopic anatomy has two fields, cytology and histology. So let's look at what the two of it entail. Cytology simply is the study of cells, which is the basic structural and functional unit of life. So in cytology, we look at each cell, its composition, its internal structure, and its functions. Okay, so in cells, we have what we call organelles. Organelles are what makes up a cell. So in the study of cells, we look at all of these, their roles in the body, and as well their internal structures. That's it for cytology. Examples of cells in the body, we have the white blood cells, we have the red blood cells, we have the platelets. We also have nerve cells, we also have bone cells. All these are examples of cells in the human. The next subdivision of microscopic anatomy is histology. Histology can also be called tissue anatomy. So therefore, histology is the study of tissues, its internal structures, and its functions. Note that tissue simply is a coming together of two or more cells that are precisely arranged to perform a particular function. I come again. Histology is the study of tissues, and tissues is the coming together of two or more cells in a precise or arranged format to perform similar functions. So generally, we have four types of tissues, of which we would look at them individually when we are strictly discussing tissues. The first we have here is the epithelium tissue. The next we have is the connective tissue. We also have the muscle tissue, and then we have the nervous tissue. So we have the epithelial tissue or the epithelium, we have the connective tissue, muscle tissue or muscular tissue, and we have the nervous tissue. When I look at these tissues individually and study them, it is regarded as histology. Take note of that. Okay, so that's it for microscopic anatomy, the study of small structures like cells and tissues which cannot be visualized with an unaided eye. Take note of that. The next subdivision of anatomy is seen as the macroscopic anatomy. Macro means large, right? Yeah. So Macroscopic anatomy is simply the study of structures that are visible to an unaided eye. Study structures that can be observed with the naked eye. Let's take note of that. We have different fields, a lot of fields under microscopic anatomy, of which we'll look at but a few in this episode. Let's list out some fields under macroscopic anatomy. We have regional anatomy under microscopic anatomy. We have systemic anatomy under microscopic anatomy. We have radiographic anatomy. We also have comparative anatomy. We also have functional anatomy. We have pathologic anatomy or anatomical pathology or pathologic anatomy. We also have developmental anatomy. We also have embryology. Okay, we also have artistic anatomy. Okay, so for the purpose of this episode, we will be looking keenly into all of these aspects of macroscopic anatomy and what they specifically study. Regional anatomy is a subset of macroscopic anatomy that studies different parts of or regions of the body individually. So when I take a particular part in the body system and I study them, look at the organs associated there and the makeup or their functions or their roles, it is termed regional anatomy. Regional anatomy involves the study of different parts or regions of the body. For example, if I take the thoracic region, for example, in the thoracic region, which can also be called the chest region, it characterizes different organs like the lungs, the alveoli, and a lot of organs associated with the respiratory and cardiovascular system, majorly in the chest region. So when I look at all of those aspects or that region and study it individually, it constitutes what we call regional anatomy. Another example could be the study of the abdomen or abdominopelvic region. We also have the pelvic. We also have the head and neck. We have the upper extremities. We have the lower extremities. Those are different regions of the body. When you study them individually or separately, we refer to that kind of study as regional anatomy. Take note of that. We have systemic anatomy. Systemic anatomy simply studies the structure of the organ systems that makes up the human body. It studies the structure of the organ system that makes up the human body. Examples of such systems are we have the endocrine system, we have the gastrointestinal system, tract system. We also have the urinary or renal system. And lots more. We have the integumentary system. We have the nervous system. There are a whole lot. So when I study all of these systems, their roles and function, it is termed systemic anatomy. You should also note that all of these systems are interdependent. So for the overall functioning of the system, that's the body, we must ensure adequate functioning of all of these systems. So by the time I study each of the systems that makes up the human body, it is referred to as systemic anatomy. The next we look at is radiographic anatomy. Radiographic anatomy here simply means the use of imaging tools such as CT scan, that's computed tomographic scan, and also MRI, magnetic resonance imaging, in studying the internal structures of the human body is what we refer to as radiographic anatomy. Radiographic anatomy uses imaging tools such as CT scan and MRI, which is magnetic resonance imaging, to visualize the internal structures of the human body. Note that radiographic anatomy is majorly used for diagnosis. Okay, if a patient has a fracture, what is used to diagnose or visualize the fracture or abnormality in the patient is with the aid of these imaging tools. So the study of the use of these imaging tools the to take note of the structures in the internal parts of the body is what we refer to as radiographic anatomy. The next we have is comparative anatomy. Comparative anatomy simply is the study of the structures of different species. Okay, for example, if I want to make a comparison between Homo sapiens and Homo erectus, we make use of comparative anatomy. It studies the different species, okay, of organisms. Comparative, it compares different species of organisms. In comparative anatomy, it is the bedrock that gives rise to the relationship in evolution. Evolution talks about the different trends, okay, of organisms. So what is the bedrock for evolution is comparative anatomy. The next is the functional anatomy. Functional anatomy can also be called applied anatomy. It is simply the study of the structures as well as their function in relation to physiological mechanism. It is seen as the study of the structures and functions in relation to physiological mechanism. Take note of that. We'll get to know what physiological mechanism entails subsequently still in this series. Pathologic anatomy. Pathologic anatomy studies the structures or the changes in structures that occurs due to a disease. So when I have an invasion of pathogens or a disease condition in the human body, which alterates the normal state of the structures in the human system, it is referred to as pathologic anatomy. I study it and then the disease causing organism that causes that changes in structure. That branch of anatomy is called pathologic anatomy. For you to understand the abnormal, you must first of all know the normal. Okay, so in pathology, there's a delay, there's a change from normal to abnormal, and what causes that is basically or generally a disease condition. The next type of macroscopic anatomy we have is developmental anatomy. Developmental anatomy studies these changes in structures that occurs from conception up to adulthood or maturation. So the changes in structures that occurs from conception. Conception is the first stage in pregnancy, okay, that occurs after fertilization or yes, after fertilization. So when I have the formation or the coming together of the different or opposite sex cells, and then I got into the conception stage. The study of the different changes that occurs from that stage up to adulthood is referred to as developmental anatomy. The study of the changes in structures in the different um, stages of human developmental. The next is embryology. Embryology oftentimes is usually interchanged with developmental anatomy, but they have some distinctions, disparities, dichotomy. In embryology, we study the changes that occurs from conception up to 8 weeks in intrauterine during pregnancy. So for embryology, it studies the changes that occurs from conception up to 8 weeks. Embryology is a subfield of developmental anatomy. As developmental anatomy studies conception up to adulthood, embryology studies conception up to 8 weeks, as the case may be. The next we have is artistic anatomy. Artistic anatomy studies the structures of anatomy in relation to visual art, fine art, and lots more. In anatomy, we have what we call models. Models are sculptural representations that give the exactitude or similitude of a particular organ or part of the body system. So for me to have a sculpture of these organs that makes of these organs of the body system, I would venture into artistic anatomy. Take note of that. It studies or is a branch of anatomy that deals with the relationship between anatomy and fine arts. Take note of that. So that's it basically for the different subfields of macroscopic anatomy. I hope you're finding this class interesting. Any concerns should be dropped in the comment section. The next objective of this class is to checkmate the relationship between anatomy and physiology. So let's delve into that to end this episode. Okay, relationship between anatomy and physiology. Let's look at the difference, then we look at the relationship, how they are related. Anatomy studies the structure, the shape, the organization of the different parts of the human system. Physiology studies the functioning of that structure. Physiology studies the functioning of that structure. Take note of that. So, anatomy is to the form of a structure, physiology is to the function of that structure. Take note of that. So let's look at the relationship. What is the relationship between the form of a structure and the function? Note that physiological mechanism is dependent on anatomical structure. Physiological mechanism is dependent on anatomical structure. We have talked about physiological mechanism. So let's explain that. Physiological mechanism simply means the way or means of the functioning of any part of the human system or the human organ. The means of functioning of any part of the human organ, the way it functions. That's what physiological mechanism entails. So let's give an instance. I have the heart, for example. The heart has a layer called the myocardium. The myocardium is seen as the muscular layer of the heart. The essence of the heart being muscular in nature is because of its function, is because of its role. The major or primary role of the heart is to pump blood for circulation within the body. If it is not in the form of a muscle, do you think it will have the capacity to pump blood? No. So the essence of, or yes, the essence of the form in which an organ takes is dependent on the functioning of that organ. Please take note of that. The heart is muscular because of the function it portrays or it carries out, and which is pumping of blood. It requires a lot of energy to do that. You can imagine if it was not muscular, how that functioning would have been able to be carried out. Another example is the lungs. The lung is an organ in the respiratory system. It's basically responsible for the exchange of gases within the body. But the nature of the lungs is thin. The essence of this is because of easy exchange of gases in and out of it. Easy exchange of gases in and out of it. If it was not in this nature, it won't be able to perform that function. So take note, there is a close relationship between the functioning and form of the human body. The form of in which any organ or system takes is dependent, or the function of any organ in the human body is dependent on its structure or its shape. Let's take note of that. Ladies and gentlemen, we have come to the last session for the episode in Introduction to Human Anatomy. See you in the next episode.